Dear Lords, Ladies, Honourable Members of Parliament, City Councillors, Commissioners, and all who do amazing work in the area of mental well-being in the United Kingdom. Thank you for listening to this appeal. It is made as a rallying call from the heart to help us to unite in our actions to disrupt the current negative cycle of declining mental well-being in our children and society in general. BBC News headlines make us all aware of a deterioration in mental health and lack of resilience on a daily basis. For example, more than a third of female students have mental health problems. Children in care too often denied mental health care. Head teachers warn of pupils with untreated mental health problems. Head teachers calling 999 because of mental health issues. MPs highlighting that there is poor support which is failing some of the most vulnerable young people in our society. We all know the issues, but the headlines go on and on every week. I'm driven to calling out now because of yesterday's BBC News headlines, highlighting a report commissioned by the Department of Education that says teenage girls' mental well-being is worsening. The final two paragraphs spoke to us at Zoomos directly, which reads, "The study suggests that the problems of mental health are so widespread that broad spectrum initiatives aimed at all young people would be valuable. However," I quote, "it would appear that there is little in the way of low-hanging fruit. Simple, low-cost initiatives are difficult to identify." Well, Zoomos is such a simple, low-cost initiative. We are that broad spectrum support solution referred to in the research. And we are able to deliver Zoomos to every child in every school in the UK immediately, at no more than a few pounds per head. And we don't know of any other system like us out there globally. But how do we get ourselves noticed? How do we get over the stigma that we are not a charity and only in it for financial gain? Over 10 years of determined development, we have experienced the worst challenges a business can face to drive our strong commitment to disrupt a negative health model of dealing with crisis and not building resilience. I, for one, had nearly lost everything many times in order to create something truly innovative. Thankfully, over the years, we've had nothing but support and approval from subject matter experts, leading head teachers, health experts, doctors and psychotherapists, who have all sat on our steering groups. We now need your support to deliver and be that broad spectrum solution to an escalating crisis. We've proven our concept. We are robust. We have achieved a CAMS kite marking. Ofsted comment on us as being the most advanced information, advice and guidance system on the market. We were voted Business of the Year by Business and Industry Today. Voted top 20 exhibitors at BET and the Education Show. And every country that saw us at those shows invited us to develop Zoomos in their country. And we are now part of the fantastic £75 million Head Start project for Wolverhampton, who have been asked to take the lead on digital technology, which is, to a large part, us. However, our resources to deliver this nationally are limited. Yet every day the majority of heads and senior leadership teams that contact us say they would take up Zoomos if we were able to offer them Zoomos free at the point of delivery. Right now, we have over 10% of England's secondary school senior leadership teams evaluating and wanting Zoomos for their schools. And in the 2 weeks before summer, 34 schools contacted us independently wanting to implement Zoomos, but they don't have the budget. And we try every way possible to find a way to run it for them, through charities, trusts and sponsorship. But the process is lengthy, uncertain, and far too slow for the crisis that faces us today. So to briefly outline what our disruptor is, Zoomos is an online platform accessible 24 hours a day from the very media referred to as the preferred media in the report. It is expert-written, peer-reviewed, vocal motivational recordings anonymously accessed by children, followed through with all further help information in the form of national web links, helplines, suggested reading, books, video support, the school's pastoral system, online counselling and local support, all with anonymous communication with the school for emotional first aid. It is a complete end-to-end support system, utilising the resources that are already available. However, that is just delivering this crisis support aspect of Zoomos. We disrupt the current model by building resilience on a daily basis from day one in a school. We do this through strong school engagement and schools playing a different recording out loud every day during registration on positive thinking techniques, how to build a strong character and life skills. Recordings are very structured and continue throughout their school career, so the knowledge, techniques and habits cannot help but be adopted. Zoomos not only delivers emotional first aid and builds resilience, it then measures the change through CAMS approved evaluations for resilience, well-being, depression and self-confidence. These measurements are repeated quarterly, allowing changes to be tracked over time. Decision-making and intervention success is now evidence-based. There are many other features like games on cognitive bias modification, mindfulness and meditation techniques, but hopefully you get the idea. Importantly, the schools get live usage statistics on what is being accessed. It can be organised in different ways by male, female, which school year, how often, date ranges, as well as the evaluation results, so that they can better focus expensive support and care resources. We even have a regional and governmental level back end to our system, so a whole region or the whole country can see what is being accessed, statistically valid change data, giving the ability to cross-reference statistics, giving trends across the region or country. For the first time, it is possible to have real-time mental health statistics on the issues being faced by a whole population through what they are exploring and making a demand upon. This is how we say we will measurably improve mental well-being globally. We have the hosting, delivery system and reach. We want to deliver it. We want to link and collaborate with every other mental health support system available, bringing together the disparate support services and charities. And we call on your help to achieve this. Together, we can make a big change. We can disrupt the current model. We can break the negative spiral and nurture positive mental health in our country, but only if we all work together. I'm calling on you, our government, to find a way to make Zoomos available now to those that want and need it. We have committed our lives to this. Our efforts are sincere and collaborative. Please take advantage of us by calling, emailing, circulating, introducing or supporting. We will continue our mission regardless, but imagine the impact we could achieve together. Thank you for taking the time to listen.